record. Okay, everybody can see. Oh, sorry, start at the end. Okay, here we are.
Okay, so thank you all for allowing us to come in and work with your organization and all the time you've given us already. We feel very welcomed by your team, and we would like to share a bit more about the profession we're pursuing right now. If at any point you guys have any questions, feel free to type it in the chat box or unmute. And before we get started, if you guys have a pen or a pencil and a piece of paper nearby, I ask that you grab that because we have a small activity planned towards the end of this presentation. Wait, Danielle, go back. It's okay. Okay, so to start off, I just wanted to give a brief definition about the profession of occupational therapy. So OT's goal is to aim to help people at any stage in their life do the things that they want and they need to do through the therapeutic use of daily activities, and those are what we call occupations. Our profession is evidence-based, and it enables all people to live life to its fullest. We help to promote health. We help to promote health, prevent or live better with injury, illness, or disability. This is accomplished through designing strategies for everyday living and customizing the environment to develop and maximize the person's potential. Okay. So I like to stress how OT is not meant to fix people, but instead to empower people to be motivated to sustain all aspects of their health by enabling occupations. And that's why I put it in red, just to kind of promote that word. But by taking the full picture into account, the full picture being a person's psychological, physical, emotional, and their social makeup, OTs can assist people in achieving their goals, in functioning at the highest level possible, in concentrating on what matters most to them, maintaining or rebuilding their independence, and participating in the everyday activities that they need or that they simply feel like makes their life worth living. So OTs assist individuals to develop skills, adjust their home, their school, or their work environments, and build health-promoting habits and routines. OT is used as a means to enable people to thrive and work to get beyond their disability or the limitations they have and create ways for them to live life to the fullest no matter what. And now I'd like to transition into the specific topic of cancer. Cancer and its treatment can create challenges and disruptions and obstacles to participation in life roles and everyday activities. And so the growing population of cancer survivors across the lifespan really presents an immediate challenge and an opportunity for occupational therapy practitioners to provide occupation-focused and evidence-based interventions that can help support participation in everyday life.
So we'd like to better define the role that OT plays amongst the amazing team of professionals like the staff at our clubhouse in supporting clients in oncology care. Occupational therapists work with clients of all ages across all stages, so from diagnosis through treatment, as well as through palliative care or survivorship. Services are adjusted to suit the changing needs of the client that will vary from stage to stage and sometimes even from day to day. Caregivers are also often supported through the process with education on how to best support their loved ones. Cancer has a way of disrupting so many different aspects of a client's normal life. And as many of you can probably report from conversations with members, individuals with cancer or in remission miss what life used to look like, the things they used to do with their time that brought meaning to their lives. OT may support clients to build or regain strength and skills that were weakened by treatment, or weakened by treatment, or they may help identify new ways to participate using helpful techniques or adaptive equipment, or they may be assisted in finding alternative occupations and routines that meet the client where they are at the level of ability that they do have in that moment in time. So we have some pictures here to kind of represent all the things, not all the things, but some of the things that we might cover. So these images provide examples of important occupations that are often disrupted for clients with symptoms related to cancer or cancer treatment. So we address issues with basic self-care activities like bathing and grooming, deficits that interrupt participation in more complex tasks such as meal prep, work participation, and other tasks requiring higher level executive functioning. In addition to challenges with intimacy and body image, changes in sleep patterns, and any challenges to participation in leisure activities. So we may do this by a number of ways, some of which we might offer education on energy conservation, work simplification techniques, so we might have them practice pacing and prioritizing, or organizing the environment so that less energy is required to collect items needed for a task. We also do something called task analysis, where we watch a client perform a task in their natural environment, and this allows us to see where breakdowns might occur. We might then be able to suggest modification to either the activity itself or changes to the environment. And we also do interventions that may include education on stress management, use of coping strategies, and relaxation techniques. Ultimately, we'd like to raise a client's self-awareness and empower individuals over the course of our work together to be able to self-identify when they may be experiencing a particular challenge in their occupational performance and function, and how to problem solve using strategies and techniques we've provided in their own environment and within their own daily routine. So now we'd like to introduce to you the Kawa model.
Yeah, so occupational therapy is based off of a lot of different frameworks and models, but one model, the Kawa model, offers an innovative approach to OT, and it was inspired by the Asian culture in which it has a strong connection to nature. So as a part of this approach, there's a subjective assessment that we use. It really helps open the conversation of personal context that appears to be affecting the client's health and their well-being. It can help to improve their awareness of the factors that they might have not otherwise considered. And it helps to initiate the collaboration between the occupational therapist and the client when creating goals for occupational therapy treatment.
So this is what we're gonna be wanting you guys to do with that paper and pencil. So I'm going to describe the different elements to this. We have basically the Japanese word for river is kawa. So this whole thing is a metaphor to describe a person's journey through life. And the water represents life flow. So ideally, the water will have plenty of space to flow with limited obstructions, and this would symbolize overall health and well-being for the client. The river walls and river bed are representative of the environment, so any type of context that offers support or may be considered a barrier. The rocks and the boulders, so they are the difficulties or problems an individual is currently experiencing. So the rocks are smaller problems, boulders larger problems, and the driftwood, so these are the personal attributes or resources. So they can be positive or negative. They're either going to float unobtrusively down the river, or they might block the flow when they get logged between the rocks and the river. And so we wanted to present, Sydney has an example here of the one that she did. And so as you go through the process of making your own models, we will have Sydney go over some of the aspects of hers, and we've kept a key in the corner so you can kind of refer to it as you make your own.
Yeah, so I wrote up mine last night, and I figured it would be a good reference for you guys if you kind of get stuck. But I kind of made my drawing to where it's like a cross section of the river to kind of resemble at this right now, this point in my life, this is how I feel. But the river bed or the river walls I made first. And it's just, I made it kind of like a normal loop and then like straight across and just right back up. You can make it however you feel. But some of the things, most of the things I put in there were like supportive, like family, sense of community, having a stable home, having supportive friends, things like that, access to education. And then I had a couple of the more negative ones, like due to our current situation, I put lack of meaningful hobbies because I feel like I don't really have a ton of hobbies outside of school that I like engage in that brings me some type of happiness. So that was one of the big things. And then also due to school, like I'm nervous, lack of relaxation, feel a little bit sleep deprived, things like that. Oops, what else did I put? Okay, and then for the rocks, I put things like fear of the future, just because right now I'm in our entry-level doctorate program and just not really sure about how it's going to go whenever we start going on our level 2 field work, which is where we basically work 40-hour weeks as OTs at a certain setting. So it's going to be a lot more demanding. I also put the current state of the world just because that was one of the big problems and difficulties I feel like I'm struggling with now. Student loan debt, because that just brings me a lot of anxiety. And then some of the driftwood, I just put like I feel like I'm flexible, adaptability, like I can kind of work my way through whatever, like I'll make it through, kind of. That's the attitude I have. I feel like I'm a very reliable person, empathetic and goal driven. But one of the little driftwood pieces I put kind of closer to the rocks because I feel like it's a personal attribute that can be positive and negative, but it could like hypothetically lodge with the rocks and impede my life flow. So that's why I put it kind of closer down to the rocks. But I still like had these little blue lines just to symbolize that, yeah, there is a lot of spaces through. So like my life is still flowing and I feel like overall I'm not struggling as much as I used to be. But at any point, if you guys want to feel like you want to share what you guys put or how this specific activity maybe made you feel, you can in the chat or just unmute.
So we should go ahead and do our own river?
Yeah, you can make it however you would like, honestly. This is just an example for me, but just draw your riverbed first and start drawing around in that, like your environment, social, physical, whatever you feel like represents you right now. And kind of just work your way through to get to the boulders and the driftwood pieces.
Also, as everyone's drawing, if anybody had any questions, feel free to ask us those as well that are related to like OT and OT's role in oncology care. We're open books. And even if you guys don't want to share, maybe you can show us your handy artwork.
I put for my riverbed family, but also like especially given like thinking about Ginsburg's passing, I'm thinking of like a patriarchal society definitely like limiting one's river flow, and I didn't realize how much she dredged up a river for people, for women, especially women professionals. So I'm thankful for like my part of the river there being a little deeper because of her. For boulders, I put student debt, social revolution, and then for like some of my driftwood, I put humor, I'm organized, and I'm empathetic.
That's great. Thank you for sharing, Kaylee. Would anyone else like to share or has any comments about the activity or questions?
Share.
Okay.
So for my life flow, I just put my day job as a family therapist, school, family, the clubhouse, friends, the office, stress, workload, deadlines, collaboration, music, and food. And for the environment, so the river walls, I put supportive coworkers, family, and a lot of organization. For the rocks and boulders, I put the hours in a day because there's not enough, and other people's concern with my life flow, I guess, and the workload. And the driftwood would be my work ethic, motivation, passion, and yeah.
That's awesome. Thanks for sharing, Kayla. Wow.
I can share just a quick, the experience was interesting because you really get to sit down and really think about, all of these different factors that you're really managing through, like the positive, negative, your attributes, and then the challenges, just what are yours as opposed to what is the environment challenges. So I think that was very interesting. And of course, I always love to draw. So you have my heart, you guys.
Awesome. Thank you so much. Well, we want you all to feel free to continue to exercise this whenever you feel it necessary to kind of have that further self-reflection of where you are in time and kind of get a visual of what's going on and where you can kind of make some spaces for better life flow. But also we want to make sure that everybody feels free to reach out to us. As we go through this process, we're definitely going to want everyone's input on what you think from either the presentation or what you've heard about OT outside of the presentation, and we would love your input on what we can offer through our program. So feel free to reach out. Did you have anything that you wanted to share, Sydney? Okay.
I just wanted to be appreciative of you guys for giving us your time and you guys actually participating in this and taking it seriously. We really appreciate it.
Thank you.
I have a question.
Yeah.
So how do you use this with clients or members or whoever your population is? How do you incorporate this into like a treatment plan?
Yeah, I'll speak to it a little bit. Occupational therapy is very client-centered, so we kind of get from the client what they feel like they're struggling with, and this can help identify some of the struggles that they're having, and then we can work together and like collaborate on how to fix whatever they're struggling with. And like, not all of the things have to actually be like, I mean, some of the things can be like physical. Like what came to mind was like if someone has diabetes, like that can be impeding them. So like diabetes could be one of your boulders, or you know what I mean? Like health management in general. And that could be something that we could work on.
So you kind of identify what the boulders are, and then from there you talk about maybe one of the hardest ones that they're challenged by or whatever it might be, and then you kind of go from there and develop a plan with them.
Yeah, and you can also motivate them in a way by like taking a look at their riverbeds and even the driftwood to give them a little bit of positive feedback from the things that they already think they're pretty good at.
Mm-hmm.
Right. It gives a good visual to that evaluation process that we would go through in any session. So this is just one of the evaluation tools that we might use, and it's good for people who are very visual, allows them to kind of assess, and it gives them a bit of control to go ahead and say, okay, this is what I need through our treatment, and gives them that self-awareness and ability to self-identify what's going on with them.
Well, yeah, it's just a great way to start too. It's to build trust and have them learn about who they are. It's a neat model, a neat tool, I would think, as depending on the person, right? And if they're willing to share this information, but it's different, it's unique.
This feels like models that you see in social work too. And I'm wondering, I guess when I worked at Pitt, I had some students who were on the OT track, and they always more spoke about it in terms of like really assisting with the actual physical environment for people. And maybe that's like putting railings in certain places, but I didn't realize there was so much about like clinical, therapeutic, like environmental causes approach that you see in social work. So I'm kind of wondering, how does OT and social work connect and not connect? How do they define, how are they related more than I realize?
Right. I think that like a lot of health professions, and especially the professions that work with rehabilitation, there's so many sort of blurred lines. We definitely have to collaborate. There's definitely a need for communication to make sure that we're sort of addressing all the needs in our own individual way. And I think that occupational therapy, we do tend to have to advocate for like what makes what we're doing unique from what others are doing. And part of that is that all of our work is occupation based. So all of our interventions will always incorporate some sort of occupation through the process, as it is occupational therapy believes it as like both the means of healing as well as the end goal. I don't know if that kind of clears it up, but you are right that there are a lot of things that we will both be working on simultaneously, but just the perspective kind of changes.
Okay, cool.
Yeah. Okay, well, thank you guys. Anybody have any other questions for Danielle or Sydney? All right. Great job, guys.
Very good. Thanks.
And we're gonna these guys are working on a plan of how a couple of presentations or how they're gonna work with our members and maybe even with the staff. We're talking about that and looking more into that. I know that they've scheduled some time to meet with the staff and get to know you a little bit more and get some feedback from you. And then they're gonna sort of give us like a plan for what their projects will be moving forward. And we have them until mid-November-ish, I wanna say. So we'll be seeing them hop in and out of stuff, which is great. So we're really happy to have them here. All right, so with that being said, I'm gonna move on to